Good afternoon, everyone. Thank you for joining us today. We have an exciting session, something new that we've put together that's brought to you by both the Adirondack Rural Health Network, which is a program of AHI, and the North Country Telehealth Partnership, which is a program of Fort Drum Regional Health Planning Organization and AHI. My name is Katie Cook. I'm the Telehealth Project Manager at AHI, and today's session is Chronic Disease Prevention and Management Education, transitioning evidence-based programming to a virtual learning environment. I just want to go over a few housekeeping items before we kick off today's session. Please confirm that you are muted and your video is off. While no one's line will be unmuted, all questions should go into the chat. And to avoid an echo on your end, please make sure you've chosen either computer audio or phone audio and not both. For optimal viewing, we recommend using side-by-side mode in Zoom. To activate this, you would click on View Options at the top center of your screen and choose side-by-side mode from the dropdown. Again, use the chat freely to submit all questions and comments. We will be holding them until the end of the presentation, and we will do a panel style Q&A at that time. This presentation is going to be recorded and archived on both the ARHN and Telehealth Technical Assistance Center websites by early next week. And at the end of today's session, there will be a link to a post-event survey placed in the chat box, as well as emailed to all of you in attendance. It's 3 short questions, and it will help us to guide future educational topics like this. So without further ado, I want to introduce our panel of experts today. First up, we'll have Ann Morgan, who is the Executive Director of the North Country Healthy Heart Network, which is also a rural health network, just like the North Country Telehealth Partnership and the Adirondack Rural Health Network. We also have with us today Anne Marie Snell, Executive Director of the St. Lawrence County Health Initiative, another rural health network. So it's rare you see 4 rural health networks partnering together on something, which is very cool. And last but not least, Julie Cook, who is the Lifestyle Program Director of the St. Lawrence County Health Initiative. I'm now going to turn it over to our presenters, starting with Ann Morgan. Ann, if you'd like to kick it off.
All right, sorry, it takes me a minute to see where all of the toolbars are here. Thank you so much. That was a great introduction. I want to thank the Adirondack Rural Health Network and the North Country Telehealth Partnership for bringing this program together. It's an honor to be here, and so thank you. So as Katie mentioned, I'm Ann Morgan, the Executive Director at the North Country Healthy Heart Network. And just a little bit of background on our agency.
Ann, real quick, if you go to slideshow at the top, there we go, awesome. Now it's full screen, thank you.
Yeah, no problem. So the North Country Healthy Heart Network is actually based in Saranac Lake. We have projects that cover Clinton, Franklin, and Essex County. We were originally incorporated in 2001, so actually I only recently realized we're in a 20-year anniversary year here, so hooray for the Heart Network. But we were established 20 years ago by a collaborative of healthcare provider organizations and other community-based organizations to serve as a neutral organization that could bring together diverse partners across a larger region at that time to prevent chronic disease. Our mission is to design, develop, and help implement strategies to decrease the incidence of cardiac disease, stroke, and related chronic illness in Northern New York. And our role in achieving that mission is really to help our partners build capacity for implementation of chronic disease prevention programs and activities. So in other words, we do not actually deliver programs. We work with our partners. We identify key partners in the community for whom it would make sense to deliver these programs or coordinate these activities and help them to make that happen. We have, I say current and pending programs. We have 3 core programs at the Heart Network. Many of you are already familiar with the Creating Healthy Schools and Communities grant. And with that project, we were working with schools, businesses, convenience stores, and municipalities to really implement policies and practices that would help to increase opportunities for physical activity and consumption of healthy foods, in this case, specifically in Northern Franklin County. We finished up a 5-year project last September, and we're waiting to see if that's going to be renewed, hopefully soon. We also work with the Health Systems for a Tobacco-Free New York project. This is a project that really targets medical and behavioral healthcare providers across a very large region to support implementation of evidence-based strategies for treatment of tobacco dependence. That project, we finished up a 5-year cycle of funding last June, and we're still waiting for New York State to implement the next round of funding for that. The third project that's at our core right now is the North Country Chronic Disease Prevention Coalition, and that's really what brings us to this presentation today. The coalition was formed in 2019 with the support of a New York State Rural Health Network Development Grant. And what we did or are doing is bringing together key stakeholders in Clinton, Essex, and Franklin counties to really focus on increasing capacity in the region to deliver evidence-based chronic disease prevention and self-management programs. Our initial partners included the Tri-County region's larger primary care systems, as well as all of our public health agencies, HICSNY, which is the Regional Health Information Organization serving our counties, the Adirondacks Accountable Care Organization, and Adirondack Health Institute. And so for the last 2 years, in year one, we really focused on, really understanding what the regional and partner capacity was to do this work. We identified some, gaps and opportunities and built stakeholder interest in, really working together to deliver chronic disease self-management in the region. And what we did in the last year then was to really, put together a plan for addressing those gaps and, moving forward with some of those opportunities for improvement. So the key outcome in year 2 has been establishment of what we call a shared services model for delivery of chronic disease self-management in the region. And so what you see here is just a graphic representation really of all of the different roles, the key roles. It's not all of the roles, but key roles that need to be fulfilled in order for us to deliver chronic disease prevention and self-management education across the region. I'm going to call your attention to the lower right-hand graphic, program leader training, because before we can actually deliver these programs, we need to have people trained to deliver those programs, and that's really going to be the focus of today's presentation.
And I don't see a graphic on here. Did it pop up in a different window, perhaps?
Oh, I wonder if it did, and I don't know how to fix that.
If you click on share screen, it'll give you different screen options to share.
There, awesome. There you go. Yeah, so this is just, like I say, these are all the key roles that collectively we as a coalition have put into place. So we've got the Heart Network playing a key role with marketing and communications as we start moving forward. We're working very closely with our Office for the Aging and NY Connects to support referral management needs. The providers, both medical and behavioral healthcare providers, will have a key role to play in helping us to recruit people to participate in these programs. We all collectively bring money to the table. We're all funded in different ways. We hope that we're going to be, really coming together more as an integrated community health network and starting to secure some contracts that will support all of us in doing this important work. And like I say, in the lower right-hand corner, you'll see leader training is a key role. Without the leader training, we're not going to be able to deliver programs. So that's really just kind of laying the foundation, I guess we could say, just introducing or couching the rest of today's presentation and really turning it over to the Health Initiatives Lifestyle Program and Training and Technical Assistance Center to talk with us about the programs that they're helping to build, helping us to make available across the region, and how they're doing that in a way that we can get these trainings delivered virtually as well as in person, hopefully sooner rather than later. And with that, I'll turn it over to Anne Marie Snell.
Okay, thank you, Anne, and thanks to the North Country Telehealth Partnership and the Adirondack Rural Health Network for making this happen today. I'd like to spend a little bit of time just introducing what the Lifestyle Program Training and Technical Assistance Center is, and to really understand that, you also need to understand a little bit about the health initiative. So our mission is to measurably improve the health of St. Lawrence County residents and residents of the North Country region through collaborative community efforts. And as both Katie and Anne, we are a rural health network. Our member organizations are listed to the left, and these were our founding members and are still governing our organization today. The programs that we currently provide can be really broken down into 4 different categories. We do provide direct evidence-based community education, currently in the form of the Diabetes Prevention Program and the Adolescent Pregnancy Prevention Program, where we go right into the school districts in St. Lawrence, Lewis, and Jefferson counties. We provide network coordination and development. So that's where our Lifestyle Program Training and Technical Assistance Center comes in. And also our Community Health Improvement Planning Coalition, which is Bridge to Wellness. And finally, Food Access Program Alliance, where we bring together the food access folks here in St. Lawrence County together to really work on strategic planning and succession planning and determining where their challenges are in serving the community and connecting them to resources elsewhere outside of the community. We do provide policy system and environmental support in the community. Currently, we have Senior Squad and No Kids Hungry, where we again are focusing on food access issues in particular areas of our community. And we also have Cancer Prevention and Action, which serves St. Lawrence, Lewis, Jefferson, and Oswego counties. And finally, really important to improving the health of the community is ensuring that everyone has access to equitable care. We provide health insurance enrollment assistance and Healthy Kids, which is really essentially as well health insurance enrollment assistance, particularly targeting our youth in St. Lawrence County. So that brings us to our Lifestyle Program Training and Technical Assistance Center. This center, really, we've been providing evidence-based education with chronic disease self-management for over 12 years now. And that has consistently been as a direct service to our community members. Eventually, as we moved through the delivery of these programs, we noticed and identified a gap in our region for our leaders like us to connect to one another for networking opportunities, and then also for technical assistance. There were technical assistance centers that were statewide, and we found it to be a little bit troublesome and burdensome to connect with those technical assistance centers. So we looked at and investigated if it would be cost effective in our region for us to have some master trainers embedded within the organization who could serve the community. And our strategic planning in that process really identified that, yes, it was a need not only for our local community in St. Lawrence County, but more broadly across the North Country region. So we have put this into several different areas of our funding. Rural Health Network supports this opportunity in our current 5-year grant. And with that, we're looking to increase the capacity of our partners in St. Lawrence County to deliver effective and standardized evidence-based programming. In addition, we are partnering with the New York State Office for the Aging on a 3-year grant. We're nearing the end of year 2 right now. We started out with a 5-county region. Those are those purple dots that you see on there. and we are expanding into 8, adding in the yellow dots. Now, it's important to note that with these delivery models, we have several other partners in the region who may not necessarily be written into these funding opportunities, but are delivering programs. So our partners in Jefferson and Lewis counties, and we really do want to support them. So they are involved and can benefit from the Training and Technical Assistance Center as well. What this program really does, this center, is of course training. We have the only 2 master trainers in the North Country region, so we can certify leaders to provide this evidence-based education in the community. We also have the only diabetes prevention program master trainer in the North Country, and you'll be hearing from her in just a moment. We do host many different opportunities for training throughout the year, and that has significantly increased as far as opportunities for trainings for these programs this year. We provide technical assistance. So primarily with Fidelity, you know, as providers, you want to make sure that you are referring to a program that's standardized and completed well and efficiently. So our Technical Assistance Center really assists our leaders in maintaining fidelity with, you know, Julie has frequent meetings with our peer leaders, our certified peer leaders, and part of these meetings does include training and, you know, just upkeep on certification and standards. Data collection, we are working closely with New York State Office for the Aging and Compass in maintaining and ensuring that our leaders are entering the correct data into Compass, which is the portal for data collection. We also assist with the recruitment and retention of leaders and provide ongoing leader education. So it's really, you know, really important. The other support that's provided is just that networking, being able to pick up the phone and call another leader in another region who may be experiencing the same barriers. It's really important to have that network level of support. We are working to standardize the dissemination of classes. And again, this effort is supported and done in partnership with the North Country Chronic Disease Coalition. We provide recruitment support, and we'd like to be a one-stop shop for referrals. So what Anne spoke about earlier with the referral process and using the New York Connect system, we do anticipate that a lot of those calls can come to us should there not be a class that is currently scheduled for referred participants. This way we can maintain a list of individuals who are eligible and interested in participating and ensure that our leaders are aware that they ultimately can have a class ready to go because of this ongoing list. So really what we'd like to do is just provide an overview of what these evidence-based programs look like. I'm going to turn it over to do that. Julie Cook is our Lifestyle Program Director. She has well over 10 years of experience in providing and delivering these programs and is one of the master trainers for the Chronic Disease Self-Management and the only master trainer for the Diabetes Prevention Program in the North Country. So Julie, I'm going to turn it over to you and you can tell me when to advance.
Thank you. I'm not sure. Can you see me? Can you hear me?
Yes. Yes.
Okay, good. I just can't see my little version of myself in the corner, so I'm not sure if you can. How's my hair? No. So, yeah, so we're really excited to be able to be a training center up here in the North Country. This is wonderful because first of all, one of the biggest barriers is being able to come together cost effectively, time effectively to be able to train. And so we're up here doing this. And why are we doing this? We're doing this for these wonderful suite of programs that I'm super excited about. I'm trying to hold my horses and really keep the descriptions down to a minimum. The first program that we offer is the first program that was developed through Stanford University, the Chronic Disease Self-Management Program. It's the 101, if you will. This program is a 6-week-long program that we offer to individuals. By design, it's for any type of, well, by definition, anything that's considered chronic, anything that interferes with your life or you feel challenging, that is defining as chronic health problems, whether that's from diabetes or anxiety. It's the whole gamut. These classes are designed for those that are currently experiencing the problem, and we very much encourage whoever's in their world to come and support them. So that could be another family member or friend or caretaker. So maybe we advance the next. Yes, thank you, Annie. So what you have here is the Better Choices, Better Health program, which is basically the same program, but this is available online by demand. And we're very fortunate through to be able to have this offered to our North Country residents through our grant through NYSOFA and ACL. This, however, it's 6 weeks long. However, it's at their own pace. So one can drop in and drop out throughout the whole week in order to finish their week-long class. And this is designed for folks, the same. It would be any individual that is considered having any kind of chronic condition. Could we advance then? Okay. Diabetes self-management program. The same format as your 101, the chronic disease self-management program. However, there's emphasis on diabetes self-management. So this is for folks that are diabetic or who are pre-diabetic or who are considered at risk for diabetes, and as well as any support person in their life. We like to, I guess how I recruit is to talk to folks about, okay, maybe you speak with your physician about diabetes, and you talk to the registered dietitian about diabetes, and maybe your appointments are 3-4 months in between. How do you manage the day-to-day, the Monday through Sunday with this condition? This is what we talk about at these workshops. Thanks, Annie. The chronic pain self-management program. This is really a very unique program. It is the same format as the chronic disease self-management program, but there the emphasis is on self-management of pain. And really is very informative, and folks begin to understand where is pain, how is it created, like how does the body process that, and what are ways to manage this. We have frank conversations about opioids and other medications, and exercises. There are some light exercises that are done every week through the 6 weeks. It makes it very unique program. And with that, we invite those who are experiencing the chronic pain, and if they do have a support person, they too can come. Workplace chronic disease self-management program. This is also very unique. This is like a work-life balance, and this program is designed to be delivered within a workplace. However, it is only those that are invited are those that are only the employees. And it discusses chronic health conditions. However, to keep the anonymity, it's never actually discussed openly about what conditions folks are having, because they are working with one another, and it just keeps the privacy. But it's more of a, like, it's an approach, like work-life balance. It's something that everyone can really benefit from. So this is and then this is 6 weeks long. However, we meet twice a week for 1 hour each time, so that it works within the work week. And Cancer Thriving and Surviving. This program is designed for both folks that, same format as the chronic disease self-management program, anyone who's ever been touched by cancer, whether they're currently going through treatments, or they're in remission, or they're a support person. This is a very, very, very powerful workshop program, and it really gives folks additional tools to navigate through their world. And this is also designed 6 weeks long and 1 hour a week. Very powerful program. And lastly, we have the National Diabetes Prevention Program. This is actually a year-long program designed for those that are either pre-diabetic or at risk for diabetes. We meet for the first 6 months, we meet weekly. It's 1 hour a week. There are 2 goals within the first. The goals are for participants to lose 5 to 7% of their weight, and to consistently obtain 150 minutes of activity each week. So that's the goal by the end of the 6 months. And then for the last 6 months of the year, we work on maintaining that or increasing that. And those classes, depending on the group and what they decide upon, they can be either monthly or bi-weekly. Did I mention? Yes, they're an hour long. Okay, I think that's it.
Thank you, Julie. I'm going to pop in real quick just to do one slide. So I do want to mention, as far as these programs go, an organization who wishes to deliver must have a license or be recognized or pre-recognition status with these organizations. So licensing for the Chronic Disease Self-Management Suite, which was the first number of slides, except for Better Choices, Better Health, and Diabetes Prevention, is licensed through the Self-Management Resource Center. Now, with that said, as an organization, many of the organizations, which we'll get up to here in a moment, who are delivering in the North Country region, have a license through New York State Office for the Aging. So as part of this grant that New York State Office for the Aging has right now through the Administration for Community Living, they have an umbrella license through the Self-Management Resource Center. And we do encourage our partners to license through Office for the Aging for a number of reasons, but primarily because it's free right now to partner with New York State Office for the Aging and have a license to deliver programs. Now, diabetes prevention program is a little bit different. If you are hoping to bill for this delivery, you need to be recognized by the CDC with this program. And in order to become recognized and maintain recognition, you have to hit a number of points, which we can describe a little bit later, and also share with you afterward. But you must maintain certification again in order to deliver these programs in the community and to bill for them.
Okay.
I'll turn it back over to you, Julie.
Thank you. So moving these programs that I just discussed into virtual delivery form, this was quite a task. The Self-Management Resource Center, formerly known as Stanford, they really worked tirelessly and very quickly within the first few months of when we were all went into shutdown mode, to be able to take these programs and develop, they really changed them up and developed them into a different format, because before it was all in person, and it was really actually, honestly, the program itself was designed to be very, very simplistic. It was meant to be able to be delivered within the basement of a church, or in, just anywhere. It's actually an international program. So technology was not to be actually used. We were not allowed to use any type of PowerPoints. A flip chart is all we, and some markers is all we really were allowed to use to be able to deliver and it, by design, it was meant to be like that. So then how did we transcribe that to virtual? Well, we first started with the telephonic delivery toolkit. So this is, it's unique. It's only about 1 hour that you work with individuals, and we call, the leader calls their folks telephonically, and it's a very small group, a conference call, and you work with them one-on-one. Virtually, that took a few months later to develop, but now we have the ability to have our leaders deliver, because like Anne Marie had mentioned, the fidelity and the standardization of this program is extremely important and valuable. And so that took some time to get up and running. So now we have slides. It's really kind of really big flip flop from what we first learned the program, how it was supposed to be delivered. And but they've done this, and with the continuous updates, I think there's been about 8 updates in the last year of how it is constantly being revamped and decided upon how we will deliver programs. At this time, because of the licensing, we have to adhere to that, and it is not allowed at this moment to deliver in person. So this is what we're working with. And then we're really grateful for the other option that we have, the Better Choices, Better Health. This was previous. This has been, I'm not sure how many years that this has been in operation, but now this has really been turned to heavily, because this is an online program. So we're very excited to be able, as a training center, to now be able to train our leaders to be able to deliver these programs in this manner. So there are pros and cons. Real big emphasis on the pros. Virtual. What's really neat about this, when we deliver programs, so for example, St. Lawrence County it's huge. And it was very tough for us to say, for the diabetes prevention program, to go to the other part of the county to deliver 1 hour program once a week for a whole year. So it was very tough. So what's really neat now is we can bring everybody in the room together from different parts of the county effortlessly. More leader collaboration and opportunities. This really, how this could be represented is the county lines dissolve too. Anne Marie told you we're working with 8 counties, and if we have a leader who is has certification in diabetes self-management program in Essex County, and actually that is a very good example, because there's no one else in Essex County that has certification. There's only one peer leader in that county. And so that leader now has an opportunity to deliver the diabetes self-management program by, say, having co-leading virtually with a leader from, say, St. Lawrence County, until we are able to train another person from Essex County. So that really is very helpful. We help each other out, promotes that partner collaboration. More flexibilities with participation. So weather, there's no driving to get anywhere. And honestly, this time of the year, from like December to March, we never really did have in the past opportunities for programming, because we really thought that that was very tough to ask our folks to be able to engage in that. And now that is not a non-issue. Homebound or bedbound individuals can now participate. So it's really interesting. We did have a telephonic class delivered this fall, and one of the individuals was actually going through rehabilitation at the time, and then actually transition back home. So, the programs are 6 weeks long. So I think for 3 weeks she was in rehabilitation, and the last 3 weeks she returned home. And what a valuable tool and support to have her telephonic chronic disease self-management program. She was very grateful for it. In fact, she's very much considering now to become a peer leader herself. So this is wonderful. Reduces the likelihood of absenteeism. This is really true. If you have pain, if you're experiencing pain, it can be very daunting. If you wake up in the morning and with chronic conditions, this happens. Anyone who has chronic conditions knows that in the morning you may wake up to unexpected pain. And the thought about going to the local library in person to do your chronic disease self-management class can be very daunting. And this way you can participate at home. Then another reason to think about too, like absenteeism is really pulled down, is that up here in the North Country, transportation is very difficult. And we often hear of individuals saying that I do not have a way to my program, or perhaps, the weather. So that removes that obstacle. Expands accessibility to the full suite of programs. So like I had mentioned, you may have a peer leader in one county that's trained to do one of the programs, but not all counties have peer leaders trained in all programs yet, anyways, till we get that, get everyone trained. So in the meantime, that's what's really neat. So I think only in St. Lawrence County, out of our 8 regions, I think in St. Lawrence County, we only have peer leaders trained in pain. And so this is what's really neat, is because this one county can offer pain self-management programming to all of the counties. So that's how it expands. The anonymity. This is something that's really something that got discovered to be really to an advantage and a benefit. With the telephonic, you are not, of course, seeing participants, and for whatever reason, that really does help to open up some folks. They do feel the ability to be able to share more. We did learn one of our partners, Citizen Advocates, they work with folks who go through a number of, like are struggling with some issues, and it's very tough for them to open up in person. And they themselves, the leaders, were apprehensive to do the telephonic version, and to their genuine surprise, that they learned their participants actually preferred this, and they really saw them blossom. So the cons, what are the cons? Well, especially here in our remote North Country, the accessibility to internet, it's very tough. It's very tough. And then not only because of the remote and access in that sense, where the lines are drawn, but actually financially, that can be really burdensome for folks to take that other bill on. Technology can be very confusing. I myself included. I am not a tech bug for any stretch of the imaginations, but it can be very, very And then our folks, chronic health condition programs, we tend to see folks of the elder population. And so this can be very confusing to them, and actually even non-existent. They might not have any type of device in their household. Limited to see everyone. Well, speaking of devices, maybe they have a device, but maybe it is a smartphone. And with that, that can really be confusing and upsetting to not be able to see everyone in your class. And so that can kind of take away from that sense of I'm in a whole class. Leaders themselves might miss that personal touch, because when you have your class, when you're with the workshop, you really get that sense of being able to read your class and to be present with your class and to be able to actually read body language, and that may be missing. We found it was especially missing at first with our telephonic, but then we found ways to get around like that. Like when an individual is done talking, then we can ask them to say thank you, or I'm set, or I'm done. And then that lets the other participants know when they can go. So we're learning at this. Some people do not want to be seen, especially that first week when you connect them. You might see a lot of eyebrows. They only hold the camera up so far, but by the second week, they're up here. So they become more and more comfortable. The feeling that you're on TV does seem to fall by the wayside. It's really important for us to remember and to be respectful that we're entering folks' home, and that does have some cons to it. Some folks are very sensitive, and it can just feel a little unnerving, like I'm inviting you, you are in my living room with me. On the other hand, we've had a lot of folks say, this is great, I am in my living room in my pajamas and I'm really enjoying this. Some folks really they cannot be swayed to join your program. They say, I'll wait until we can do something in person, and we're respectful of that, of course, and we put them on that waiting list until we have that opportunity to deliver once again in person. And then lastly, what we're finding, especially as an agency, is the updates. The virtual platforms and the continual updates, they can be weekly actually, and this can really throws you a learning curve, and it especially can throw a learning curve just when you think you've established something with your individuals. The next week they're coming up with something new. So that can be a challenge. Let's think the next slide, Anne Marie. Okay, so our current partners, this has been expanding at a rapid pace, and we're very excited. You have here folks from all of our 8 counties representing and supporting and getting very excited about this work, and asking for more and more training opportunities. In fact, we're trying to plug some in at any opportunity and chance we have. So we're really, really excited about this. We work with everyone that you've seen here. Either they have peer leaders already that are existing, or they are in the training process, or they just are there for support for these programs. They may not have peer leaders, but they may be there as a referral and part of our referral network. So we're very excited it's expanded.
Thank you, Julie. So, despite the pandemic, this data is from September of 2019 through February of this year. There has been a number of workshops still held. And you know what, you have to remember as well that the transition to virtual took a great deal of time, not only for the Self-Management Resource Center to develop the materials in this platform, but then also for them to train the master trainers, and then for the master trainers to train the peer leaders. But our partners have really taken this and moved forward. despite the challenges. So there have been a number of workshops held. Excuse me. In addition, you'll see here the number of participants and the number of completers. I did see a question in the chat about comparing that to the previous 20 months. And I will tell you, I do have that data and I can share it afterward. But we have seen a slight decrease, but only slight decrease in the number of workshops held, the number of participants participating, and also the number of completers. And what's more with this decrease is that we have seen a decrease in the percent of participants that are completing. And I do believe that we don't have the full answers to why that is, but certainly it could be attributed to some of those challenges and cons to virtual delivery that Julie mentioned earlier. So we're working toward and looking to analyze that data a little bit more as we move forward. And that leads us to the end. As far as how to be involved with this, if you are interested in getting your organization licensed and training peer leaders, Julie Cook would be an excellent resource. If you would like to be involved with the Chronic Disease Coalition, I did put Anne's email on here. The integrated delivery network that the Chronic Disease Coalition is working toward is really going to help sustain these programs in the long run. So we're excited to be able to partner with the North Country Chronic Disease Coalition. Thank you.
Excellent, thank you all. So if Anne Morgan, if you could pop back on, we'll do some Q&A. We've been getting questions throughout the session. So excellent. All right, so we did get a few questions actually submitted ahead of time, so I'm going to start with those. First one, and Julie, you did touch on this a little bit, but how do you maintain engagement in an online atmosphere?
The online atmosphere, so you mean the virtual delivery? You're not speaking of Better Choices, Better Health, right?
Online atmosphere, meaning the actual program being delivered virtually. And if you're not a speaker, please make sure your video is off.
In the engagement, well, that's a very good question, because we do really try to field that out prior to the actual workshop. You will have individuals, we really need to clarify that that they're up and running. We need to have them demonstrate this. So whether that means the peer leaders or a technical person, or anyone from an administrator from the agency that is holding the program, or the technical center ourselves, that folks are ready to roll and all those kinks are kind of out before they start. So we really must really insist that they have way of video, because if we hear a lot of yes buts and a lot of apprehension, then we do say this, maybe the telephonic version is more appropriate for you, and we can really definitely point you in that direction. So no, we really try to get folks comfortable with all of that first. And so whether that's a one-on-one and just a nice run through. Another way that's very helpful, and this is per the suggestion of SMRC, and it's very valuable, is to have a third person. So these programs are designed to have two peer leaders, but however, they ask that you have a third person, and it doesn't have to be a very techie. It can just be an individual who may, hopefully it would be wonderful if they are already familiar with the program. So we like to invite another peer leader sometimes if they're available to help us out, but always have that third person so that the two leaders can do that, just actually lead. And that's very helpful. And then you have the participants know that they can lean on another person for a tech issue, if you will. So yeah, that's we've really seen engagement with that.
Okay. So we do have a good number of questions, so I'm going to keep going. This one's an interesting question. I'm not sure, given patient confidentiality, if this is even possible. Could someone attend another online chronic disease self-management program to see how it's done?
Do you mean as not a participant, but just kind of like just really kind of just get a sensation of it? Is that what you mean?
It wasn't my
Yeah,
question,
I was thinking
so
about it too.
It wasn't my question, so I can't confirm what
Oh,
the intention was.
well,
With that.
I will just say, really one does need to be enrolled. They really do. I'm afraid that there's maybe not a way to capture that feel else in another way. No, I'm sorry.
Next question, is it possible to get more master trainers trained for our region?
I'll take that one.
Yes.
Yes. Yes, there it is. And we do have a plan within the Lifestyle Training and Technical Assistance Center to attempt to do just that, not only internally, but with external partners as well down in the southern parts of the region. It's certainly needed. And we're at a point where the desire and the asks are growing to be able to deliver this service. So therefore, you know, the demand for that is demanding that we have more master trainers. It's not an inexpensive venture, but it's certainly doable and pays off in the long run. And if your organization is interested in having a master trainer, recognize that they do have to be certified in CDSME, current, you know, have certification in order to be a master trainer as well.
Excellent. Anne Marie, you touched on this question during your presentation, but there is a question around, have you seen overall participation across programs decrease from 2019 to 2020 despite the availability of virtual or telephonic delivery?
Yeah, you know, and this is hard, and I haven't asked our partners at Office for the Aging to pull the data in, you know, in that way. So the dates that I have don't align necessarily with pre-COVID, post-COVID. The data that I showed there was from September of 2000. What did I say? September of 2019 to today, essentially to February of 2021. And when I compare that with the data for the same 20-month period prior, it has decreased, but not as significantly as you would think when there was a good 7-month span without programming.
Yeah, good point. Next question is, do you think it would be possible to connect with clients prior to discharge from the hospital to improve their transition to home?
It's a really good question. I'm going to let Anne take that one.
Yes.
That kind of put me on the spot. I'm like, yeah, but I'm not sure. Yeah, I think absolutely. And I would say that if that's something you're interested in, I would be interested in talking with you. And my thought is that we would probably run that through this newly developing referral management system that we're working in collaboration with the Offices for the Aging on. So I know many of you, hospitals are probably already connected with your NY Connects teams, and so that would be the process. But like I say, we're in the very early stages of really defining that process and trying to get the training together for the Offices for the Aging so that their staff, their NY Connect staff, are able to really help patients get connected to the most appropriate program for them. So.
Mary, who leads our health home at AHI, was the one who asked that. So
yeah, Mary, hi.
So definitely want to connect.
I'll reach out, Anne. Thank you.
Yeah, great, yeah.
Next question, and I think this was touched on a little bit, but is there a course that one must take before you can deliver online chronic disease self-management?
Well, actually, so There was, for all the pre-existing leaders, all those that were certified as peer leaders, they did need to be brought up to speed on the new curriculum. And so yeah, so there was that, and we're very fortunate. There's about 30 peer leaders in our area in the North Country, and they are all up to speed. So that was quite something. In moving forward, that took some time too to develop how to do the peer leader training virtually as well. So we had to wait to the top of the year to be able to deliver that. So we're doing this now. That does have a little bit of a challenge because how it's being delivered now is the assumption is there that they're going to be delivering virtually. And so that's interesting. And so when we are able to actually start delivering programs in person, then those newly trained leaders are also going to have to be updated with how to do in person. So it's kind of the opposite. So our folks that were used to delivering in person had to be trained how to do virtual, and then coming down the pike, it will be vice versa. Does that make sense?
Yes. Next question, and I like this question. Are you tracking any impact on avoidable admission or emergency department utilization related to chronic disease?
I wish my colleague Ellen is here.
I'll just jump in and speak from the coalition's perspective that we're not there yet, but we're working in that direction. We're hopeful that that would be part of the integrated community health network process, and really building that additional support that we're going to need to be gathering data on the healthcare side and on the utilization side to be able to really measure that and monitor.
All right, and I'll take one more question. How do we get our peer leaders trained and updated? We have 6 peer leaders.
Oh, wow.
If your peer leaders are currently certified, you need to email Julie. And Julie can provide that information to you, certainly for when our next courses are. Mm-hmm.
Excellent. And that is the last question that we had submitted. So thank you all for submitting your questions. That was a great Q&A. Sarah did put the link to the survey in the chat at the beginning, so we greatly appreciate it if you could take a few minutes to take that survey. I want to thank Julie, Anne Marie, and Anne for taking the time to present on this great topic. It's incredibly important, and being able to shift to a virtual environment for a program that's historically been in person. I applaud all 3 of you, well, Ellen as well, in your efforts in doing that. So thank you very much. We will, of course, be archiving the recording and the slide decks on our websites later this week or early next week. So take a look out for that. And, certainly reach out to myself or Courtney Shaler, who runs the Adirondack Rural Health Network, with follow-up questions, or any of the presenters today. Thank you very much. Have a good one.
Thank you, everyone.